I'm checking all the time.
When Jennifer Koski gets a symptom, maybe a headache or a rash, she hits the internet to learn more.
There are horrible pictures of rashes online, right? And part of you says, well, thank goodness mine doesn't look like that.
But for people with health anxiety, which Jennifer does not have, the glut of health and medical information on the internet can fuel worries.
Sometimes you assume things are worse than they are because of what you see. And instead of maybe just having it be a little dermatitis, you're thinking, now I have a skin cancer.
It's called Cyberchondria, searching the internet because of illness anxiety, but that searching makes the anxiety worse.
I have worked with individuals who spend 5 to 6 hours a day, every day on the internet.
The worst things you can feed into is you start looking at these symptoms list. But you start talking yourself into some of the other symptoms, I think, or you worry that you have them.
Instead of being reassured by the information, it heightens your anxiety until you're convinced that something is very, very wrong. Blogs with comments from people who are not health experts, while sometimes helpful, can also be problematic for people with cyberchondria.
You know, if I didn't know better, I might start panicking a little bit about some of the scary things they're saying could be happening and what I should be doing.
Now, Jen's able to keep all this in perspective, but the question is, when does it become a problem for which you need to shut the computer and get some help?
But it needs to be treated. When it gets to the extent that it's governing people's lives, causing them interference with their day-to-day functioning, their roles with their family.
Mayo Clinic psychologist Dr. Richard Syme says that's when it's time to talk to a healthcare professional. He says cognitive behavioral therapy, or CBT, can help break the cycle of searching and calm fears. It involves helping people weigh the evidence that a symptom such as a stomachache is more likely to be a benign condition than a deadly one. It also helps people learn to live with their uncertainty and reassure themselves when they experience distressing sensations or symptoms. And it helps get people off the internet and back into life.
But I'm pretty good about stopping myself and saying, okay, common sense.
But if you can't stop yourself, take Dr. Syme's advice and reach out to healthcare professionals who can help. For the Mayo Clinic News Network, I'm Vivian Williams.